Good evening, everyone. Today, I will be speaking about the pre-operative and intraoperative aseptic protocols that we practice. It will be covered under the following headings. We begin with the pre-operative preparation of the patients. Antibiotic drops are administered pre-operatively to reduce the bacterial flora and to prevent post-operative infection. Ofloxacin eye drops 0.3% is instilled 10 times on the day before the surgery, and the frequency of installation is explained to the patient depending on the time of the admission. The patient is asked to wear clean clothes on the day of surgery. Once the patient is brought into the preparation room, the vitals are checked first. Then the patient is made to wear a disposable cap and shoe cover over their bare feet. They are also made to wear a laundered gown over their regular clothes. The patient particulars, the eye to be operated, and the procedure are verified with the patient. Then the patient is taken to the block room. A torchlight examination is done to rule out any blepharitis, discharge, or congestion in the eyes. Prior to giving either the topical anesthesia or the subtenons or peribulbar block, the eye is cleaned in the following manner. First, a drop of 0.5% proparacaine is instilled into the eye, followed by a drop of 5% povidone iodine, after which the periocular surface is cleaned with 10% povidone iodine. Care is taken to clean the eye from the inner aspect to the outer aspect of the eye, ensuring that it is not brought back inwards. Then the block is given and the same process is repeated. Next, we come to the surgeon and staff preparation. The OT dress should be worn after removing our own formal dress. Cap and mask should be worn and secured tightly. OT footwear should be worn at all times inside the OT. Once the staff enters the OT, the air conditioning is checked. The items that have been sterilized, whether the indicators have changed the color, has to be checked. And there will be a register in which all the indicators will be stuck, and the sister has to verify, and the doctor will recheck and sign before going to scrub for the OT. Hand scrubbing. It's a process of removing as many microorganisms as possible from the hands and arms by following a standard WHO hand wash protocol before starting any surgical procedure. There are 3 steps of hand scrubbing: the pre-scrub washing, which lasts for 30 seconds, then scrubbing with Dettol liquid soap, that is 1 minute once, and scrubbing with Oro Scrub, 2 minutes twice. The total scrubbing time is 5 minutes. A poster showing the method of scrubbing will always be there at the area of the hand wash. Coming to the drying of hands. The palm is dried first and then each finger with a sterile towel. Next, dry from the wrist to elbow. After drying the elbow, avoid retouching or drying the hands with the same towel. Once the sterile gown is received, it's gently opened well away from the body and the hands are slid into the sleeves. The circulating nurse secures the gown from behind. Gloving can be done in 2 ways, as shown in the pictures on the left side. First, the right hand picks up the cuff of the left glove and the left hand is gently slid in. Then, the fingers of the left hand are inserted into the inner aspect of the cuff of the right glove and the right hand is slid in. Another method is wherein the assisting sister opens the glove for the surgeon to wear it. The surgeon wears double gloves at all times and the outer glove is changed after every patient. While degloving, we should ensure that we touch the inside of the glove before removing. Hand rub usage for the circulating nurse, they have to use it before opening the sterile bin, opening the lens box, changing the balance salt solution, opening the OVD or suture, etc. and before putting the drops and bandage at the end of the surgery. For the assisting sister, after wearing the sterile gloves, after putting the eye speculum, at the end of each surgery and before taking the sterile instruments from the CSST bin. The aseptic techniques during surgery. Once the eye is draped, a speculum is used to retract and cover all the eyelashes. Using 5 ml normal saline, the draped eye should be washed thoroughly. A cotton wiper should be placed at the lateral side of the eye to absorb all the remnant fluid. 0.12 ml of intracameral moxifloxacin 0.5% is given intracamerally at the end of every surgery, and in case of any complications such as a PCR, 0.2 ml is injected. Never hydrate the wound after intracameral moxifloxacin is given. In case there is a need to reform the anterior chamber after injecting the intracameral moxifloxacin, it needs to be repeated. Thank you.